Not sure I'd remember how to put one on.
Yeah, John, I think it's known as COVID casual.
Yeah.
Good morning, John. Can you hear me?
I can. How are you, Marie?
I'm well. How are you?
Good, thanks.
Okay, so I'm gonna put myself back on mute. I just wanted to make sure that I got it.
Yep.
When it's time. All righty.
And it just turned 9 and the participant numbers are going up. So I'm just going to give it just a couple minutes. If that's okay with everybody.
So fine with me, John.
Okay. It's like when you make popcorn, when it stops beeping, right? When we go a few minutes without any more beeps, then we'll go. $53, wow. 5. Oops. 30 more seconds. Wow, that's great. Okay, I think the last kernel just popped and it's 9:03, so why don't we get started? Welcome, everyone. It's terrific to see so many people joining us again under kind of some strange circumstances. I was looking back at my calendar and remembered that we had a meeting on February 7th and we had horrible, horrible weather, and we were concerned about the weather keeping us apart. So things have changed a little bit. Along for the good old days when it was the weather that was keeping us apart. But we're so happy that we're it's going up now. We're approaching 70 people on this call, which given everybody's demands and limitations is absolutely phenomenal. So thank you all so much for joining us for the task force meeting. We've actually, in spite of everything, made some really, really terrific progress, and the working groups have just been absolutely inspiring in terms of how much they've been able to do in spite of some real significant challenges. So I'm looking forward to having the working group chairs report on all their fantastic work. I did want to go ahead though before we got into that, and it seemed like now would be kind of a good time to regroup a little bit and just look back a tiny bit. So Kelly, if you could go to the next slide, please, real quickly. This is where we started, and I just want to kind of go over the top part there. We started with one vision, and the vision is bold, exciting. It's a big, hairy, audacious goal, the BHAG, for those of you familiar with that, but it's achievable, and it's been inspiring to see how much we have achieved, how much you all have helped us to achieve some really, really remarkable things that are really directly improving the quality of life for people in Erie County. So again, it's very, very bold and exciting, but we're seeing progress toward it. And it's the kind of thing that makes it a little bit easier to get up in the morning and come in and do this work. You know that we're serving 3 populations: the children, working families, and older adults. And again, the working group chairs are going to report on what they've done with all of that. But this seemed like a really, really good time to revisit the 5 guiding principles that are driving this work. So Kelly, if we could go to those, please, in the next slide, that'd be great. Thank you. And I can tell you, and I hopefully get a lot of nodding here, when the implementation team meets and we talk about what we're doing, these are front and center constantly. I mean, the guiding principles are more than just boxes we check. We don't just say, yeah, let's kind of say this sounds important, so we'll put it on a document. These guiding principles really are guiding us. And given the events of the last few months and the pandemic and everything we're facing, I really wanted to focus on the commitment to addressing racial inequity. And at the first task force meeting where we met, we had some guest presentations really talking about structural racism and how that impacts all sorts of outcomes and every aspect of people's lives, and really trying to give people a better sense of what inequity meant and how it impacted people. And we've maintained that. So every meeting since the very first task force meeting, we have brought back and with slightly different spins and slightly different takes, but we're talking about racial inequity at every single meeting because it's that important. And if nothing, again, the last few months with a heightened awareness around George Floyd and Breonna Taylor and the disproportionate impact of the COVID pandemic, all these things have really bright light on this issue. And we've really stuck with it. So I just want to say to everybody involved that's heartening to see that, again, it's not just something that we put on paper because we thought it looked good. It's something that really, it's a living, breathing commitment that we've made, and we continue to stick with it. Nothing has been more indicative of the commitment to racial equity than Erie County's response to the COVID pandemic. And we are very, very fortunate today to have County Executive Mark Polenkars join us. He's going to talk about Erie County's response and what the current condition and state of the COVID pandemic is in Erie County. But the mortality rates in Erie County, well, first of all, nationally, and sorry, you can say that for the county executive, Kelly, that's okay. But nationally, it's well documented that mortality rates for African Americans are so much higher, a lot of times 33% higher than they are for the white population. And Erie County initially had that same inequitable outcome. But really, over the course of a few weeks, Erie County was able to, with Mark Polenkars and his team, and a group of really committed community leaders, just over the course of just a few weeks, get the mortality rates for the African American community much more in line with the community as a whole. And that was not an accident. That was completely by design. And it took a lot of really creative thinking, a lot of very fast acting people, and a lot of dedication of resources. So it's a terrific case study. And again, the Erie County, I know, has gotten national attention for this response. So again, County Executive Polenkars and your team and the other players should absolutely be lauded for that terrific outcome and that change. So with that, I am going to turn it over to County Executive Mark Polenkars to discuss the current state of the COVID-19 pandemic in Erie County.
Thank you, John, and thank you all for once again serving on the Live Well Erie Task Force. It's been a very difficult time the last few months. While our community is doing better now, we can't keep our eye off the ball. We know after seeing what's happened in other communities across the United States that when people think that things are normal, of course it's not normal, and the numbers get bad again. And I want to thank each and every one of you for the work that you've done through your organizations, not just on the Live Well Erie Task Force, but to help get our community through this outbreak and this crisis. I've had a lot of people ask me saying, when are we getting back to normal? And I just remind everybody, I don't know what normal is anymore. This may be the new normal. It certainly is going to be for the upcoming future. And I think we just need to understand that as we move forward. And if we do that, we'll be a better community for it. You see on the screen the COVID-19 case data as of August 17th. We've had more than 9,000 total positive cases. Now, those are not repetitive cases. Those are individuals. So it really should say 9,000 total positive individuals in Erie County out of 264,000 tests, COVID-19 diagnostic tests. Those are not antibody numbers. Those are actual diagnostic test numbers. So it's a pretty sizable amount of the individuals that we've tested. that have tested positive. And of course, when we look at the antibody numbers, it actually, in all likelihood, is higher as a percentage of our community. We think that, and I don't necessarily have a slide coming up, but we think approximately 6 to 7% of the Western New York community has, Kelly, could you go back just for a second? 6 to 7% of the community actually has contracted COVID. And that's the fear, is that even a lot of those folks are asymptomatic and had no idea. They went and got an antibody test and then found out that they had the positive antibodies, and they were shocked because they really never were sick or had very mild symptoms. So it just goes to show what we have to worry about. 676 people have died in Erie County. These are all lab confirmed cases. We don't do presumed positives here. A lot of people are trying to spread information that these are presumed positives, that people who just die in a hospital were determined to be COVID positive, and that's not the case. It's individuals who were tested positive for COVID and then died as a result of their illness. And it's not every individual who tested positive for COVID that may have died. For example, I do know of some cases where individuals were in late stage cancer and at Roswell Park, and they may have tested positive for COVID, but it wasn't COVID that killed them. It was the cancer that killed them. So we have here 676 people that we believe are directly died as a result of contracting COVID. And then there were, as of the 17th, there were 25 individuals admitted to Erie County Hospital for COVID. That number is actually the same from the numbers that I'm getting here with regards to the most recent day, which let me just make certain I got it here. I don't know what I did with it. Anyway, I just think it's the same. So it's still 25 people in Erie County hospitals. 6 are in the ICU. 2 individuals had an airway assist. Airway assist means they're on a ventilator. So there are still people that are very sick. It's just a very small portion of our population than before. And here's your the stats for the most recent period. These are 2-week periods. I point down to the bottom line. That's the deaths in hospitals. And so it wasn't that long ago when it was not surprising to see 6 or 7 or higher numbers on a daily basis dying in hospitals. And now we're basically at the most we're having is 1 death. And it's just a 3 deaths in the last 2 weeks in hospitals. Not everybody who dies of COVID dies in a hospital. Someone may die in a nursing home, but this is indicative of how it's at least being treated better now. We have better ways of treating COVID. And the hospitalization numbers have stayed pretty stable the last couple of weeks. Actually, the last 3 or 4 weeks, we've been in the low 30s or 20s, and I'm glad to see that. It's a slight little bump from August 13th to August 17th and still today. I'm not so worried about that. If we continue to see that number go up, then yeah, then we're worried, because that means people are contracting it and having to be hospitalized in an area hospital. And then there's one other thing that's not included in this. Individuals are going to hospital emergency rooms to be treated for COVID because we know that they aren't included in the hospitalization report. But we do get information of individuals who go to an emergency room for the illness because they are sick. They're tested, they may be determined to be positive, but they're not hospitalized because they're not at that level of care that needs to be held overnight for hospitalization. So we once again remind everybody that COVID is still out there. We are still seeing individuals that are testing positive, and there are still individuals that are being hospitalized as a result of it. If you go on to the next slide, and this slide shows that it runs the age gamut. It doesn't really matter what age grade you are. You can contract COVID. You'll see the numbers are very small on those that have tested positive from basically birth to 19. This is because we haven't tested a lot of kids. We've actually seen those numbers going up recently because more children are being tested now, often because they have a family member who tests positive. So somebody says, hey, I'm in my 20s, I can't catch COVID. Oh, you can catch COVID. The question is whether or not you're going to get sick from it, and whether or not you'll have to be hospitalized. The odds of you dying are very, very slim. Generally, if you're under the age of 60, the odds of dying are slim. The problem is that does not mean you can't get very sick. There are people who've caught it, who've been very sick, and are still dealing with the after effects, even though they technically don't have COVID anymore, and including in the younger age ranges. And of course, a thing that we're very worried about are individuals in the younger age ranges catching it and passing it on to older members of their family, older members of workforces, who then are much more at risk for getting sick and death. So just because you're young does not mean you can't catch COVID. And the largest age group that we've tested with the most positives, I should say, is the 20 to 29 age group. And it just goes to show that just because you're young means you're not necessarily immune to it. Next slide. As we look at cases by gender and residence, we've seen of the ones we've tested that nearly 56% of them are female. Now, with regards to Erie County's population, I think it's about 51.5% of Erie County's population is female. So this number is a little higher than normal. It's also, we think, because the number of the individuals and positions that are more frontline workers, including in hospitals as well as even in grocery stores, are often filled with a higher percentage of females than males. So it's not totally surprising that that number is like that. We have seen, though, a greater preponderance of cases in the city of Buffalo than the actual population of the city of Buffalo is a percentage of Erie County's total population. 47% or so of our total cases are city of Buffalo residents, and the city of Buffalo only makes up 28% of the population. So we are still very concerned about this. And we have worked all along with our partners in the city of Buffalo, including the Ignite Hope Task Force, the Racial Equity Health Disparities Task Force, and we'll be announcing something with them very soon to continue a number of programs that will be funded by the county going forward to reduce the transmission of COVID, as well as the impact it can have on those who are more at risk. So this is a concern. Though, as John noted, we have some good numbers, which is the next slide, and that is the actual deaths as a result of COVID by race and ethnicity. And this is where we're doing much better than other parts of the country. Our population of Black or African American is 14.6%. Erie County's population, 14.6%, are made up of Black or African American. And the percentage of fatalities is only 16.4%. There's only a few communities in the United States who can say that. We do know downstate there was a much greater percentage of people who died as a result of COVID-19 that were people of color. So that's a good thing that we've done here to address the spread of COVID, which seems to be affecting the city of Buffalo and people of color at a much greater propensity than you would normally expect based on our population. And then with regards to Hispanic or Latinos, it's actually a smaller percentage of those who died than what is the actual percentage of Hispanics/Latinos in Erie County. So those are good numbers. It shows the effort that a lot of individuals have put in place, and it's not just the county. It's the hospital systems, it's urgent cares, it's doctors' offices. As I said, it's the Health Disparities Task Force. There's so many people that played a role in this, the city of Buffalo, New York State. And I don't want to say it's a success story, because anytime you have people die from anything, it's sad. And every death is one death too many. So it's not a success story as much as it shows that when we came together, we could address what was a significant concern. And when we were in the early phases of this, as John noted, the percentage of Black/African American who had died as a result of COVID at one point was almost 1/3 of all deaths. So that was very concerning because there no way should have been that percentage. And as a result of the work of many, we were able to reduce it to what it is really kind of in the statistical variance when you're talking about the actual percentage of the population. And then we're still working on this. Next slide, please. We still have testing clinics every week. We have diagnostic clinics. We have antibody clinics. Right now, we have diagnostic testing in Williamsville and ECC South issued by Erie County. We were in a location in the city of Buffalo at a school, but the school board asked us to, Buffalo Public Schools asked us to vacate that location now that they're returning to school, or we're going to return to school. So we're looking for another location in the city of Buffalo, but we have a diagnostic testing in Williamsville and Orchard Park. We have antibody testing that rotates across the county. You can schedule testing online. It's free, there's no cost, and we generally have the quickest turnaround time. It may take you a few, like 3 to 4 days to get an appointment. That's not surprising. If you walked into one of our clinics, we will try to test you that day, especially if you're sick. We will test you that day. You don't need a lab referral, doctor referral, but they are by appointment only. Unless someone did show up, we try to help them. And there's all kinds of other testing clinics across our region and private sector locations, hospitals and the like. We generally have, as I say, the fastest turnaround. So you get tested by Erie County, you usually get your results within 2 days of the test. So with that, we've done a lot. There's a tremendous amount that we're still doing. Our COVID-19 hotline is still live, 858-2929. At one time it was 7 days a week. It's now 5 days a week. We have so much going on. And now we're putting in place what would be considered the next level response as we're starting to address issues associated with schools returning, with the issues associated with childcare, which Marie Cannon will get into in a moment, housing. We are very worried about what potentially could be an eviction cliff that we're facing when evictions are eventually allowed. Possibility for foreclosure, though, based on the information that we've gathered from the local banks, it seems like that's less of a likelihood than the eviction cliff, which would be a real likelihood. And that, of course, has so many other ramifications as a result of it. So Erie County is going to be working on a number of these projects. We're going to be announcing very soon. We'll hear more about actually what we're doing with school districts later today, as I'll be making that announcement. And we just want everyone to know that we just got to continue to spread the message that COVID's out there. When you're in public and you cannot safely socially distant, wear your mask, and we'll be all better for it. So with that, I'll turn it back to John, and I think Marie Cannon's up next. And I just once again want to thank everybody for your good work during this very, very difficult time. Thank you.
Thank you, Mark, and especially for your leadership during this time. So my name is Marie Cannon. I'm the Commissioner for the Department of Social Services and the co-chair along with John Craig for Live Well Erie. We've actually been quite busy during the pandemic, besides our regular work. And some of the things that just recently we've been able to accomplish or achieve, even in the middle of all of this, is that we worked with the Community Health Center of Buffalo with under Dr. Levon Ansari's leadership, Restoration Society, and the City of Buffalo to actually do COVID testing for folks that were in emergency shelters during this time. And we actually were very pleased to, I think, and this is a testament to the work that was done, that we only had 2 people that tested positive. So the shelters, the emergency shelters, actually did a great job of implementing health guidance and health guidelines so that to keep folks safe. So we were very pleased with that. We continue to be able to do the PPE distribution. We're in a partnership with Erie County Environmental Planning Department, and you'll be seeing it's going to be almost 1,000 additional masks that you'll see in the community, and they will actually have the Live Well Erie logo on it. So that was a collaboration with the Environmental Planning Department of Erie County. 2 other things that the county executive mentioned. You can go to the next slide, Kelly, is the convening of the Emergency Child Care Task Force, because the challenge is every school district has prepared a virtual learning model, and Buffalo just recently announced, or they are announcing, that they're going to start the school year virtually. which means that as the county is reopening and folks are physically going back to work, there's this challenge of what will people do with their children on the days that they are learning virtually. And so we've been working on this for a couple months. The first thing that is currently in place is Child Care Resource Network actually is matching parents to child care providers who can offer distant learning support. That's what we're calling it. So right now, if a person needs child care services, they can call Child Care Resource Network and they will match them up to the providers. With what's currently happening is that we're conducting a child care provider survey because one of the challenges during the pandemic was 36% of child care providers were closed, and it was as high as 43% across the entire county. So we're doing a survey that is asking the child care providers, one, are you opening back up? Two, would you be able to offer this distance learning support? And that survey will close out on this Friday. So we will be able to know how many providers are out there, what's the capacity, because that's really the question that we want to get to. And then our GIS department for Erie County will actually plot out where the centers are, connecting them to the school districts. We also are working with both BOCES 1 and 2. We developed a survey because, again, we really wanted to find out if parents would use a distance learning support center, would they use child care centers. We just needed to know, like, how many parents will use it, how many of them are comfortable sending their child to a different type of congregate care. And so both these 1 and 2 are sending it out to all of their school districts, and then we will see what the response is. And again, so we will match up the child care providers with the BOCES and all the other school districts, the child care providers and the district, and then that will give parents a sense of what's available in the school. We're also working with the after school network for them to be able to provide services during this time. As the county executive mentioned, we also are looking at a fiscal model to be able to support families and child care providers, and so we will have some more details on that because we do know that there is additional cost in terms of providing reduced capacity services to children, the PPE and the cleaning and the sanitizing supplies. Those are all the needs that we know that the child care providers are currently facing. So as we figure out the capacity in terms of using child care providers, after school, school-age programs, we do believe that there will be a need for what we're calling distant learning centers. So these will be places where parents can send their child during the virtual learning day, because then the child would be at a center, but they will be connected digitally to their schools, but there will be supervision, making sure that children have meals, supervision, support, help with schoolwork. So those are things that we're in the planning process. And again, that will be based on the information we get from the child care providers and their capacity, and the information that we get for parents who, if they will attend something like this, because we don't want to stand up distant learning centers and support distant learning centers if no one's going to participate. So some of the folks that have been on this task force, that are on this task force, it's been about a 40-member membership, and we've been working with OCFS, which is the Office of Children, Family, and Services, which license daycare centers and child care providers and school-age programs. We have parent advocates. We actually have providers who are doing the work, foundations and employers. They're all part of this task force because we really wanted to get a broad-based view of all the issues and challenges that are happening around childcare. So I think we got some good first steps done, and we'll continue to do that work so that we can support children in their virtual learning environments and their families being able to physically go back to work. Kelly, can you move to the next one? So at the same time, as the county executive said, we actually convened, he authorized the convening of a housing task force. And again, that really was really in a response to this impending crisis around housing. Initially, the moratorium on evictions would have been lifted, but actually today would have been the day that all the moratorium on evictions would have been lifted. There is an extension through the through Governor Cuomo emergency housing task force. I'm sorry, the New York State Tenant Safe Harbor, so that the moratorium is extended, but at some point it will be lifted. And then so what we know is that a lot of people, because if they've lost their job, been furloughed, their hours have been decreased, that they could be facing eviction. So we wanted to try to figure out how big is this problem. We developed a survey, and we did it DSS for our clients, Department of Social Services, folks who receive Medicaid, SNAP, and daycare, because those would be some people who are above the poverty level. And we sent it out to about 99,000 people, and we got about 6,000 back. 6,000 with some responses back. And this is what we've learned, that of the almost 6,000 folks who responded, 32% were behind in rent, 39% indicated it was due to COVID, and 43% were behind on utilities. So that just gave us one data point. We also just ended a landlord survey because we really wanted to see from the landlord perspective, what are they seeing? And that just ended on Fridays. Just a minimum synthesis of the data is that 48% of the landlords said that if they do not receive any rent, that they will move to eviction. So we know that almost half the landlords will move to eviction. So we're figuring out what we will be able to assist. A couple of things we're finalizing. So we developed a central intake system. So we thought that people would have one point of access to get the information. We can have it triaged and then sent to the community partners. This work has been led by the City of Buffalo. They have been awesome partners in this, along with HAWNY, the Homeless Alliance of Western New York, and 211. So they have been just terrific partners, which I think is one of the silver linings of where we are. There is, at the same time, we're doing work on the eviction diversion in the legal sector, and that is being led by Neighborhood Legal Services, SELJ, Volunteer Lawyer Project, and the other legal advocates, so that they're working with the courts to divert folks from being evicted. So we're attacking this on a number of different fronts. Then the last piece that we've been doing is actually developing a single depository of resources, and actually all the resources that are available to assist folks with rental assistance is on the Live Well Erie website, because we know that there are going to be people who have never accessed any type of service before, and because of this pandemic, they're going to be new to needing assistance. And so we wanted it to be a single place where people can come to get the information and be able to have kind of a one-stop shop as you think about it. The membership for this, again, is we're meeting every 2 weeks. We have almost a 45-member cross-sector membership. It includes banks, foundations, legal advocates, the municipalities, Buffalo, Amherst, Eden, Clarence, Tonawanda, Cheektowaga, Hamburg. UB is represented on here. We have faith leaders, Buffalo Niagara Association of Realtors. Again, we took it we wanted to have this work be a cross-sector so that we could look at every avenue about what we would be able to do to assist folks. We are, as the county executive said, we'll be able to have some other announcements, which will be very helpful. But so this is the work that is happening. I see a question. It says the programs are open to working families. Absolutely, because what we know is that there's there's the families who are working who are above poverty level, but don't typically meet like a Department of Social Services eligibility. So we are looking at other resources to be able to help folks who are working that would be right above eligibility for Department of Social Services. Thank you for that question. And that is what I have. So we'll move to updates from our Live Well Erie work groups. Every Child Deserves a Chance. That is Jackie Hall and Amy Neary.
Good morning. Amy and I have been working extremely well with our children's work group partners, and much has been accomplished in a very short period of time. During our June and July meetings, we were fortunate to have partners, Dr. Quo and Leah Passage from the COIN Initiative, present to the work group what they were involved with around early childhood development. We also had a presentation from Reverend Pointer from the African American Health Disparities Task Force, who presented on what the task force was involved with during the COVID pandemic and provided strategies on how the children's work group may be able to assist. During our meetings, there was a tremendous amount of conversation on the best way to mobilize our partners to action, and as a result, began the Collective Impact Framework with Best Beginnings Partnership, formerly known as the COIN Initiative. While working with Dr. Quo and Leah Passage and Lynn Polano, we have been able to apply a theory of change approach to the children's work group meetings by identifying what activities each partner is able to provide according to their organization's mission. Each partner activity that is identified is then aligned with the Best Beginnings initiatives at a practice and program level, which is then measured and evaluated for increases and decreases against the Live Well Erie goals and indicators at a population level. For each partner's involvement, a one-page roadmap will be developed or is currently being developed to guide the work, and then we are going to apply a racial equity lens as well as receive community input and feedback prior to rolling out any of the strategies or initiatives that were identified during our meetings. Tomorrow we actually have our next meeting where we will be applying our first racial equity tool to one of our one-page documents that was created with one of our partners. Amy, is there any additional information you would like to add?
Sure. Thank Jackie. I mean, that was a fantastic summary. You really hit it. I really just want to add that it has been inspiring and exciting to help, facilitate this work group because our partners have jumped right in, rolled their sleeves up, and gotten to work from the very beginning. And even in the midst of the pandemic, they didn't stop. We continue to have a really good turnout. We averaged somewhere around 25 participants for each of our meetings. And everyone was really on board with thinking about how we could shift our focus during the pandemic to ensure that we were also developing a COVID-19 response that was going to continue to align with the Live Well goals and indicators that we had originally set out. And I think we're moving forward in a space where we will be able to continue to do both, to balance the data that originally informed our indicators that would drive our strategies and ensures that we're moving forward. We're always going to maintain a response to the COVID-19 pandemic and any of the residual effects that are going to come as we start to readapt and move forward. So I'm really looking forward to tomorrow, knowing that we're starting from the beginning, looking at how any one-pagers, any strategies that are developed are starting with it being anchored in race equity, and really then hoping to support organizations and thinking about how they can generalize that mindset not only to the strategies that we're working on, but also to their broader work in the community.
Thank you, Amy and Jackie, for your leadership on that. And so now we'll have Karen King and Christy Panagakis, Empowering Working Families Update.
Christy, would you start, please?
Sure, I'd be happy to. Hi, everyone. So I wanted to start with just kind of reiterating a lot of what Marie shared with you, is that we have been spending the last few months doing a lot helping with this research, thinking about housing in particular. So Karen and I worked with members of the DSS staff, both DSFs and from the county GIS department, to do that tenant data and mapping project. So like Marie had mentioned, we worked with DSS data, and then also a subsequent project was looking at census data and then national statistics about evictions to again try to project what did we think would happen if the eviction protections had expired today. So we spent a series of weeks working on, analyzing that data, sharing it with a series of groups of people. And now at this point, we're just kind of waiting to see what will be our next steps. And then at that point, Karen, if you want to talk about some of the other things that have happened.
Thanks, Christy. As Marie mentioned, a housing task force was formed over the last month or so, and I chair the communication subcommittee of that task force, and I'm working with a lot of really great community partners. Much of Live Well Erie's Working Families initiatives center around housing issues. So when we all met last time, we all decided that we need to pivot to respond to the most immediate needs that are happening in our community right now, and perhaps backburner some of the other overarching initiatives that were formulated last fall before this pandemic broke, but always with the understanding that a lot of these circumstances existed pre-COVID, were exacerbated by COVID, and will continue to be challenging as we move forward. So we decided to pivot around these issues that are impacting people, the evictions, the pending evictions, the lack of sustainable, affordable, quality housing, and how people are going to figure out what their next steps will be when these eviction moratoriums are lifted. We are currently working on a resource guide that will be available digitally on the Live Well site, as well as an actual physical guide that's being compiled by our committee. That should be available hopefully by the end of next week. We're really trying to push this out so people have it at their fingertips. The other pressing issue is this idea of around a paid sick leave policy. This was one of the original initiatives that we were working on pre-pandemic, and then last March, the governor decided to put it into his budget. Then within a matter of days, the epidemic blew wide open, and then there were all sorts of policies put in place, temporary policies. But we're going to continue to look at that policy closely and how it will impact people's lives when some of the criteria shifts from to a post, if there will be a post-pandemic phase, in which we all, of course, hope there will be. We will ask some of our subcommittees to continue to convene, and then we will have a larger meeting in mid-September to come back together to assess where we're at and figure out what the next step should be. The other important issue that was raised, Jackie brought this up, and I don't have it on the slide, but making sure that all of our work is informed through a racial equity lens, and that we use the tools that are available to properly assess who's included in the conversation, who's missing from the conversation, and whose voices need to be front and center. And that is all I have. Christy, anything you'd like to add?
No, that was great. Thank you, Karen.
Hi, this is David Schenk, one of the co-chairs of the Supporting Our Seniors Committee. So I'd like to say that we've met 3 times virtually since the last task force meeting. Brittany Perez moved from the UBID Center to LIST, Western New York, and she resigned as our co-chair. She has been missed, but we've been fortunate to have Karen Nicholson from the Center for Elder Law and Justice as our new co-chair. She's been a great partner for me, and she brings as much energy as Brittany did to our group, and it's great to have her with us. The Older Adults Working Group has grown to 82 members, but we are still looking for more. More ideas and more diversity is always good to find the right answers. We recently formed 4 subcommittee working groups. You can see them listed there. Their membership is growing, but they are still seeking more interested people. Each group has met at least once. And as we have all found our new normal due to COVID-19, the sub-working groups are now revisiting our original goals and initiatives for Live Well Erie. Karen will now discuss how our partners have responded as a group and how we found ways to support each other during COVID-19.
Hi, everyone. Yes, Brittany is definitely missed. I have some big shoes to fill. All of you who know her know how energetic and enthusiastic she was about this work. One of the things, obviously, that we've been really focusing on over the summer is, pandemic response, because our clients are, so impacted by the virus, not only in terms of getting sick, but in terms of the social isolation that's come out of that. So we have a Excel spreadsheet, and we are sort of putting in best practices as we talk about them, the best ways to stay in touch with older adults. The county's been incredible about developing some tools, one of which is the social isolation tool, which is a page on the website. There's another tool that we've been sharing is the Senior Tech Club tool, which really helps seniors kind of figure out how to do some of this remote learning and remote discussions. In terms of my office, we actually had a helpline that's been funded by the county for the last year. We were open 2 hours a day before, and as soon as the pandemic hit, we opened to all day long. I'll put that number in the chat box. We were taking 30 to 40 calls per day on that sort of emergency helpline that was staffed by pro bono attorneys and our staff. And I think it's really interesting that we were having these meetings while, before the pandemic happened, because it really enabled us to pivot. Just talking to the community every month and then more often on the subcommittees, it really does help you not reinvent the wheel, so we were able to just share a lot of information. One of the things that's been particularly helpful is everybody is doing trainings, everybody's doing webinars. Once a week, Christy sends out an email of all the different trainings that are available, and we're all participating in those. UB's done great stuff on racial inequities. Most of the staff in my office have been listening to those. Univera and Dr. Bruce Naughton had a wonderful training for us. Broderick's on the phone, and I want to make sure I thank him again. And I would suggest people who work with older adults maybe participate in that training, because as we're opening up, I think from a provider standpoint, there's a lot of anxiety about going back into hospitals, going back into nursing homes, going back into the homes of older adults. And hearing from Dr. Bruce really, I think, reassured our staff, as long as you take the proper precautions, as long as you wear a mask, stay 6 feet apart, you have a very, the likelihood of you catching it is unlikely if you, take those proper precautions. So I think that gave my staff a huge amount of security as we go back. So I would suggest that as well. And I can, Broderick, you can put your information maybe in the chat if people are interested in that. So our next meeting is in September. And, I think the work groups are meeting. They're using results-based accountability. We have some minutes, and we'll be discussing sort of how we move our goals forward, now that we're coming out of sort of the day-to-day kind of crisis mode that we were in for most of the summer.
Yes, actually, our meeting is the 24th of September, and thank you, Karen, for that. And I see in the chat there's a question from Teresa. What's being done to help the families and seniors that don't have access to internet and/or technology? Well, one of the things that we did here at Erie County Seniors is we developed this Combat Social Isolation webpage, and on there includes some training for people to learn how to access those things. But to really try to target those that really don't even know how to begin that technology journey, we took our Combat Social Isolation webpage and we made that into a paper brochure. And we're in the process of getting that out. We've sent it out to all the members of the Older Adults Working Group. I'm working with my nutrition staff here, and our dietitians are getting that out to all of the congregate dining sites and the senior citizen centers. So we're really hoping that we can try to improve that for our seniors. That's all I have, Marie. John.
So everyone can see that the work groups have been very, very busy and really moving the agenda forward. I'd encourage everybody, so that we have these almost 100 people on this right now, which is phenomenal. I think a lot of you, if not most of you, are involved in one committee or another. If you're not and you want to be, you are welcome. So again, Marie mentioned a silver lining before. There frankly been a lot of silver linings that have come out of this crisis, and one of the new relationships that we're all forming with each other. And I think as a community, we're working more collaboratively than ever. So it's terrific to see. I also want to say, if you want to stay informed, and here's a quick shout out to Kelly Sullivan. Look at the Live Well Erie County website. It's very well maintained. It's user friendly. It's a terrific website, and there's usually a lot of good up-to-date information on that. So if you want to know what a particular work group or anything that's going on, please use that website as a resource, because it's very, very well done. I want to now introduce Felicia Beard from the Greater Buffalo Racial Equity Roundtable, which is a program of the Community Foundation for Greater Buffalo. The roundtable was created, and Felicia, I know you can correct me if I'm wrong here, but I think it was something like 3 or 4 years ago. The roundtable is looking at a number of different domains, from education and job readiness, to neighborhood development, criminal justice reform, and building wealth and income for underserved and under-resourced communities. So if you look at, and I'm going to put in the chat box in a moment a link to the Greater Buffalo Racial Equity Roundtable website. And if you see who's involved, it's really kind of a who's who for Buffalo. And I know that they're getting the community voice as well, but the leaders at the table are people who are really able to kind of move the needle and change policies and procedures and systems. And I know a lot of that work is starting to take place already. So it's a real exciting effort, and we are absolutely delighted to have Felicia here to help us continue our conversation around this important issue. So I'm going to put that in the chat box in a moment, but for now I will turn it over to Felicia.
I also want to say thank you to, can you hear me? Just shake your head, John, I can see you. Okay. So I want to say thank you to Maria White as well as Marie Cannon for asking me to provide an update on the roundtable's work, as well as Kelly for helping to keep me on point with my presentation. So today, yes, I will be giving you an update. The Racial Equity Roundtable launched in 2016 with 32 of our community leaders representing public-private cross-sector collaboration, making an economic case for racial equity in our community. And in front of you, you have a list of the current roundtable members, our chairs, our co-chair, as well as the membership and our emeritus status roundtable members. Our work is grounded in data. So that was one of the first things, of course, that the Racial Equity Roundtable members were very adamant about. We can't just go out into our community and say we're making a racial equity case economic case for racial equity if we can't ground it in some sort of data. Otherwise, you lose the attention of people. And so I'm so glad that John put the link to the dividend report and the roundtable's website into the chat box, because there's a lot of information there, including the report. The report was commissioned by the Community Foundation for the University of Buffalo's Regional Institute to make that economic case in our community and show what the benefit would be to everyone. The economic benefit would be to everyone in our community when we achieve racial equity. And John mentioned the 4 domains that the report focuses on, and it really looks at population data as opposed to specific, there's so many different indicators we could look at, but we chose to look at 16 different population data data points. So we rolled that out in 2016, and then basically we got to work. But before I move forward with the actual work, I also want to acknowledge that, this really is a community effort. The Racial Equity Roundtable members could not do this alone. When you see the agenda that we are advancing in this community, they would have been out of their minds to think they could do it alone. We have over 250 partners and organizations working with the Roundtable, and I really want to uplift the Erie County government, especially because they are playing some key roles in moving this agenda forward. In particular, and especially, and I pray, I hope that I don't miss anyone, but we have County Executive Polling Cars and Maria White and Tim Holtz, who have been great champions. Additionally, Marie Cannon, Tom Dina, Mark O'Brien, who's newly joined, but he jumped right in and we got to work. Ron Schillerman, Eric Weigel, Brian McLaughlin, Michelle Oslowski, Amy Neary, who just spoke, and others. And as I go through the strategies, if I forgot someone, I can mention them, but just know that Erie County has really stepped up to make sure that we are advancing racial equity in our community, and they're all on board. So we'll go to the next slide. And also, I want to mention too, so if there's any questions that you're putting in the chat box, I'm not really looking at those just yet. So hopefully I don't miss anybody's questions at the end. If John could help me, I can answer any questions. So what you have before you is the Roundtable's actual agenda. The ultimate goal, the overarching goal of all of our work in the Roundtable is to achieve an expanded and inclusive economy. And that goes back to the original piece where we say we're making a racial equity case for, not a racial, I keep saying that, we're making an economic case for racial equity in our community. The moral case has been done. It's been done for many, many years. And what we call this really is our inside strategy. We're all about systems change, and it takes time. It takes time to move systems. But, you know, having the leaders at the top to be able to pick up the phone, use their networks and their influence to help move things. In some cases, we've been moving a little faster than we even expected. But overall, we understand that to fully achieve racial equity through systems change in our community is going to take a little bit of time. So what I'm going to do is I'm going to walk through each of these circles. I won't go specifically like way down into details concerning each of the initiatives. If you want to know more, please feel free to reach out to me. Just know that in light of COVID, as well as the horrible situation that happened with George Floyd, the calls that have been coming in for racial equity all across the nation to find out about the work we're doing in our community have really escalated, and so my calendar gets a little crazy. So I promise I will get back to you, but just know that I am available to at least answer some questions, as well as Clotilde. How could I forget to mention Clotilde Perez Bodie Debecker, the president and CEO of the Community Foundation for Greater Buffalo. Clotilde was doing this work before I actually got there. And so, you know, Clotilde is also a great resource to reach out to if you have any questions. So if you can see this, the circles at the top, half of this circle sheet are focused on creating conditions for change. And what that means ultimately is that these particular initiatives are focused on educating our community, educating people, on speaking to the mind as well as the heart. All of our strategies are focused on the institution except for one, and that would be our racial healing circles. The circles on the bottom, the blue circles, those are the specific systems for which the Racial Equity Roundtable identified to influence change, systematic change. So I will walk through and give you a high level of each, starting at about 10 o'clock, where you see community engagement and awareness work group. It's worthy to note that while we have a work group that's specific to community engagement and awareness, narrative change is ultimately what that circle's talking about. And narrative change flows through every circle on this sheet. It's important that we tell true, authentic stories about communities of color, because over the years, many, many years, dating way, way, way back, the story about communities of color has been sensationalized, not true, and just horrid. So we've partnered with WBFO to have a radio series as well as news reports that would tell the full story, the true story of communities of color. And as an example, when you look at health disparities, as was talked about before, and you find maybe that in the African-American community, there's a high rate of diabetes. If you just look at that on the surface, you can draw any kind of conclusion. However, when you hear the true, authentic story, you find out more about those communities that people live in where there are no supermarkets, there's food deserts, etc. Number of corner stores that have just not good food. And then you can understand why those situations might exist. So WBFO has joined as a partner to tell these types of stories. And most recently, they launched a Courageous Conversation series. I think it was launched July 27th. They live on their webpage. So if you're interested, and actually I can send them to John if you like, or to Kelly, and she can send you the link. So if you have not heard them, it would be a good opportunity for you to do such. Our racial equity and impact analysis training, I kind of want to leave for last, but I'll come back to that. The racial healing circles is now, we began them at the round table as an intercongregational strategy where we would get different congregations together, Jewish congregation connected with the African American congregation, Presbyterian, connected with a Spanish congregation, where we had facilitated dialogues, and this is our individual strategy, facilitated dialogues that were focused on race, where people had an opportunity to really talk about who they were and create a relationship. And that was really important, especially the relationship piece, because in our community, we have a 90% isolation index. And for those of you who don't know what that is, the isolation index speaks to 90% of white people in our community, or white people in our community on any given day have a 90% probability of not having a meaningful interaction with a person of color. And that doesn't mean you see somebody on the street, you say hi or whatever. That means, a conversation, a deep conversation, with a person of color. And that's scary, especially looking at the future and the fact that the majority of the nation is going to be a nation of people of color. And if people don't even know how to interact with each other, what does that say for our future? And so these circles help to really level set and allow people to see each other as human beings, and then connect afterwards for conversation, coffee, whatever. We let the circles, when people have these circles, whatever they decide they want to do, we don't dictate. None of this work is prescriptive. The racial healing circles now are being implemented through the National Federation for Just Communities. Recently, in the month of July, they did 2 sessions with the Buffalo Niagara Partnership members, and they went over very well, which was surprising because you would think touchy-feely wouldn't work in the business sector, but it worked very well. And so we look for them to do more. We also were contacted by Orchard Park to do racial healing circles, and we will be doing those at the end of August, August 31st, and I believe September 1st as well. They have just embarked on a racial equity initiative in Orchard Park, which we're very excited about, and they reached out to us for help. So this is the first step. The Buffalo Niagara Partnership Diversity and Inclusion Initiative, as you can see, that is operated out of the Buffalo Niagara Partnership, but it has several components to it. There is a Diversity and Inclusion Academy, as well as a diversity and inclusion exchange. The exchange is an opportunity for peers, people who have like similar positions or who are responsible for racial equity within their community to learn different tools and resources for being able to go back into their companies and make their workplaces inclusive, have courageous conversations, whatever is necessary in those particular bodies. And so that's being hosted by the partnership. There's also an annual diversity and inclusion symposium that we are doing. We launched our first one last year in 2019. There will be one this year, but it will be more of a webinar format, as we all know why. And then the last piece from the Diversity and Inclusion Initiative is a self-assessment of businesses. So at the end of June, the Niagara Partnership, Buffalo Niagara Partnership, released a self-assessment tool to the businesses in our community for them to look over their corporations to see, are we inclusive? Do we have, you know, diversity in our workplace? And we had really a great response in terms of results coming back. And what the partnership is going to do is use that information to develop technical assistance to help these businesses become inclusive. And we're really excited because, you know, nobody wants to necessarily identify that they are struggling in this area. However, the response came back. People were like, yeah, we understand this as being important, and we want to grow and develop. And so we're free for you to help us in this area. Our Business Leaders Task Force is really exciting. All of us are excited, but this is super exciting as well because we have 10 of our major employers in our community. The task force is made up of 12 in total, but 10 of our major employers, one large foundation, and the Buffalo Niagara Partnership make up the 12. And it's at the CEO level. And so these CEOs in our community came together and organically, again, we don't prescribe, decided that what they wanted to do to advance racial equity in our community was to set aside a percentage of their spend specifically for businesses of color to help them increase their earnings as well as develop the capacity to do more. And so we were able to, and they put their money, they took money out of their own budget to set aside for this initiative to hire a program manager, to look over reports, whatever was necessary to find out, is this something that is going to work and is this something we're going to do? And so last year, and this is a 2-year pilot for now, we intend or expect it will go longer, but we wanted to start with a 2-year pilot. Last year, we were able, through this initiative, to spend $4 million from these corporations together on businesses of color in our community. So this was huge because that was 4 times the goal that we set for the 2-year pilot each year. So that was a great thing. Again, like I said, if you want more information, I can tell you more after the presentation. Our Reentry Coalition is co-chaired by the Sheriff's Office, Tom Dina, in particular, the superintendent, and Mark O'Brien from the Erie County Department of Mental Health. We've had a number of different players, again, from the county that have been working on this particular initiative. A report was produced. I mean, I just should probably back up and say that for all of these initiatives, the ones in the blue, there is a report, a community report that was created that provided, you know, here's an assessment of our community. This is where we are in this particular system. And these are recommendations that we think will help in terms of transforming this system. And then here are some best practices around the nation that you might want to look at to inform the work in your community as you move forward. And so from the report that we received from the Bureau of Justice Assistance, United States Bureau of Justice Assistance, they offer technical assistance in this area. There were 5 recommendations, and basically we have hit all 5 recommendations, with one actually really materializing where you can touch it and feel it. On September 14th, we will be cutting the ribbon for our Service Link Stop, which is a one-stop comprehensive center for anyone who is entering back into our community from the holding center. This is really focused on the local level. However, state parolees and federal people that are coming back into our system can also access this, but this is really geared towards our local community. But they can enter into this particular center, this hub, and receive whatever they need, comprehensive package of services. And what was really key in the service link stop, so it would not be like, you know, just some other, you know, government type facility, and no disrespect, but after a while they all kind of feel the same. As we looked at different best practices around the nation, it was important to make sure that there was this warm feeling, because people have, you know, gone in, they've served their time, and now they're entering back into the community, and they need that encouragement. They need to know that they can do, they can be successful. And we have employment services there. We have a number of different things to help them do that, as well as dedicated, friendly, welcoming staff. One of the things we wanted to do originally was have like a cup of coffee, but in light of COVID, we're rethinking that as to what would be like a nice little handy incentive for people to say, oh my God, I feel so fuzzy and warm. But anyway, that'll be opening up on September 14th. Our MBK work, which is My Brother's Keeper Boys and Young Men of Color Coalition, is embedded within Say Yes Buffalo. And it really is focused on helping our young males of color achieve success academically, as well as in employment. So we're looking at this particular initiative from cradle to career. And while it started off as this coalition, it also led to another piece kind of blossoming out of it. And I'm going to say this one more time, so please don't be mad at me. We are not prescriptive at the Community Foundation, you know, and this is a community effort. So, and at the roundtable, and so whatever the community saw as a necessity as we were planning, what do we need to help young men of color, they wrote it into the plan or worked it out into the plan, and we moved on it. And so what came of this coalition was also a Breaking Barriers youth leadership program where we are teaching our young males of color how to be advocates for themselves, how to create policies, and, you know, how do you lobby, if you know, I can use that word, but how do you really speak up? How do you change your own community? And Tim Hodes was part of the initial construction of this. He mentored some of the young men, and they are doing some wonderful things. You've probably seen them out around City Hall, some other places, speaking with a megaphone and you know, participating in our peaceful protests. Tommy McClam is the director of this particular initiative. And if there's anybody who's on this call who's interested in mentoring or even speaking, you could reach out to him. He'd be more than happy to have a conversation and allow you to come in and, you know, connect with the youth and speak to them. Employ Buffalo Niagara is an initiative that is run out of Buffalo Niagara Partnership, but the focus is really on connecting, originally it was connecting employers to the job seekers. But as we continue to dive deeper in this particular initiative, we realize that there is something called like the ALEC population, asset limited, income constrained, employed. So it's not focused on the unemployed, it's focused on the people that are, you know, just there trying to make it. We are focused on transportation. We're also looking at a benefits calculator. So there's a number of pieces within this. And these are employers. You know, when's the last time any of us has really thought about what minimum wage is? Maybe some of you have because you're in government. But the average person, once you get a job and you start moving up, you don't necessarily think about that. And so when this was brought to the businesses around the table as to the employees and what they were making, it began a different conversation.
Hey, Felicia.
Yeah.
Sorry, this is John. So you've got 2 bubbles to go, and I'm giving you the 2-minute warning. And we don't have a lot of questions, but I'm sure one that's out there that a lot of people have is how can they get involved? So there are a lot of almost 100 community leaders with business ties and running their own businesses on this webinar. So if you could, again, we want to honor the time a little bit, wrap it up, and then maybe address how people can contact you to help. That'd be great.
All right. So The last two bubbles are really focused on juvenile justice in general. Youth employment is one of the solutions, and we're creating an ecosystem where we're working with all those providers to kind of do a system for the youth employment over the summer, et cetera, for in and out of school youth. Racial equity impact analysis training, I did want to mention, before I mention that, you can join us by saying, Felicia, I'm so interested in this particular system or this particular piece. Please add my name to the list for your next meeting, and we will invite you. As simple as that. The racial equity impact analysis training, I'm so sorry, but the county has been so in on this that you guys have sent several groups and continue to send many people through this training, and it helps you all to insert your racial equity lens into the work that you're doing. I was glad to hear County Executive Polencarz talk about noticing the disparities in the communities regarding COVID, and then coming back and doing specific strategies that have now level set that. That was exciting to know, because I know that many of you have gone through that training. And so I know I said I'm going to do high level, but it's hard not to talk about this stuff. So please call me if you want more information. I love to talk about it. This is our community.
And Felicia will share your contact information with everyone, so prepare to get bombarded. Thank you so much. That was terrific. That was a wonderful overview, and I'm sorry we had to rush you a little bit at the end there. Yeah, you could still submit questions if you can type quickly. We are officially at the end of our time. This was scheduled to end at 10:15. There's our next task force meeting on November 5th. Marie Cannon, anything else you want to add to take us home?
Just that to, again, thank all of our partners for joining with us on this work, because the issues that face our community are challenging and paramount, and I really believe that we can only do this work effectively and efficiently because we come together as a community, as a collective, to say we will leave no one behind. That's the new Erie County. So just again, a huge thank you to all of our partners who continue to do this work, even in the midst of a pandemic, and managing their own organizations and working with their own families, that you give up time to make sure that there are others, that our community will be better than when we found it. And we'll see you next time.
Thank you, everyone. Thanks, Kelly. Woohoo.